Hello and welcome. Thank you all for joining us this afternoon. It looks like people are still dialing in, so we're just going to give them 1 or 2 more minutes and then we'll go ahead and get started. All right, welcome everybody. Thank you so much for joining us. This is Jessica Solomon Fisher with the Public Health National Center for Innovations. I'm joined by Katie Sellers with the Beaumont Foundation, as well as Rena Chitgar at PHNCI, and we will be your speakers today. This is the first town hall for the Futures Initiative, and we're so appreciative that you've joined us. We'll have 2 more events after this, so be sure to spread the word and let all your colleagues know that we want their feedback too. A few logistics just before we get started. Everybody is on mute, but when we get to the discussion portion, we'll go ahead and unmute your lines. In order for you to participate and speak during that time, you'll need to enter your PIN. So please look to the right of your screen, find your PIN, and be sure to enter that. We'll also use the chat box to hear from you, so feel free to type questions or comments into that chat box. And I will say, depending on how many folks join the line, once we unmute you, if there's too much background noise or it's just not working out, we will have to go ahead and put you back on mute. So just a reminder to put yourself on mute once the lines are officially unmuted. Also, we will be using polling software later to get your feedback, so be sure to stay close to either your phone or computer. We'll ask at that time that you open another browser. It's very, very easy to participate, and it's really the main goal of this call is not only to share information with you, but to hear from you. On the next slide, you can see our agenda. So we'll just provide a very brief overview of PHNCI and the Beaumont Foundation, an overview of the Futures Initiative, including the activities we're undertaking for this effort, and a little bit of history about the essential public health services. But again, the crux of this is really to get your input. So we will be spending that time to poll you for your feedback and engage in discussion, and then we'll close out with just a couple of next steps. On the next slide, you can just see a little bit more about PHNCI. We are a division of the Public Health Accreditation Board, and we aim to foster innovation in governmental public health departments. One of our newer initiatives is the one that we're talking about today, and we do have several others, but everything that we learn and do is really aimed at feeding back into the PHAB accreditation process, as we are a division of PHAB. We were really excited to partner with the Beaumont Foundation on this work because we think it's so important not only to relook at a framework that's 25 years old, but to do it in a way that engages the field. And we think that we at PHNCI and PHAB are very well positioned to do that, given how PHAB was developed. And our work at PHNCI with some of the other frameworks that we support. So that's a little bit about who we are and kind of why we're here, and the importance to us of doing this work and doing it well, which means hearing from all of you. So with that, let me turn it over to my colleague and our funding partner, Katie Sellers with the Beaumont Foundation.
Hello, everyone. Good morning or good afternoon, depending on where you are. I want to echo what Jessica said about how excited we are that you joined us today. We're really thrilled to be getting your engagement and your thoughts on this project. I'd like to start by just telling you a little bit about the Beaumont Foundation and how we came to be a group that was really interested in the essential public health services and this Futures Initiative that we're kicking off with this task force today. So the Beaumont Foundation was founded by someone named Pete de Beaumont, and he was a mechanical engineer who developed very practical tools for things where there weren't the right tools available. he launched a company called Brookstone, which at the time sold practical tools like dental clamps and dovetail saws through a catalog. Back then, it did not have outlets in airports. It didn't sell massage chairs or neck pillows. But he retired in 1980 and sold the company to the Quaker Oats Company. So obviously, he made some money on that sale, and he used those funds to start the Beaumont Foundation in 1998 with a mission to improve public health. So today, our mission is to advance policy, build partnerships, and strengthen public health to create communities where people can achieve their best possible health. And you can see our website address is there on the slide if you want to learn a little bit more about Beaumont. Next slide, please. So a while back, we noticed that the 10 essential public health services were reaching their 25th birthday. And we thought about all the things that have happened in the last 25 years that have had a major impact on public health and our nation more generally. And these were things like September 11th, which changed the way we think about emergency preparedness and response. The Tobacco Master Settlement Agreement, which gave us a new way to approach corporate responsibility. Things like globalization, the development of the smartphone, the frequency of school shootings, marijuana legalization, informatics, Obamacare, major demographic shifts, and public health accreditation. So, well, accreditation may not be huge in terms of a cultural shift in America generally, but it is really important in terms of how we do public health. And I think you'll agree that all of those things I just listed have really shifted the way our country behaves and the way people think and the way public health works. So we were thinking about everything that had changed and all the things that could change over the next 25 years, no doubt, lots of things that we can't even conceive of right now. And we decided it was a good time to take another look at the framework. In a lot of ways, the 10 Essential Public Health Services is a practical tool. And so much of what we do at Beaumont is convene people to get the best ideas to use to strengthen the public health system. And PHNCI seemed like a really natural partner, an organization that is driving and supporting innovation, that's looking ahead and trying to make sure health departments are going to be able to address what comes next. And their association with PHAB, of course, which has standards and measures that are based in the 10 Essential Public Health Services, just made a whole lot of sense to us. So we worked with PHNCI to put together a task force that could guide this futures initiative that we're talking about today. And we invited a diverse group of leaders representing state, local, and federal public health, non-governmental public health, foundations, academic institutions, nurses, advocates, and other partners to serve on the task force. And the answer from these folks was an enthusiastic yes. So we're getting the task force started up this month and next month. But the vision here is that we will gather feedback from people working in the field of public health to find out what they can see on the horizon, to learn from them how we may need to change our organizing framework so that we can be ready for the public health challenges we'll face in the next 25 years. So we've been having a lot of conversations with people, gathering feedback during meetings and online, but this is our first town hall, and we're really excited to hear what you think. We think this is extremely important work. There's a lot about what we can do in public health that has remained the same over the last couple of decades, but there's a lot that's changed. And the 10 Essential Public Health Services is used for a lot of different things. The field really relies on it as an organizing framework. So we want to make sure that we have the right framework for the future, and we're really glad you've decided to help us create that. Next slide, please. So some of the things we're hoping to learn are, for whom is the framework intended? And what is the purpose of the framework? What elements or definitions should the framework include? And how should we update the framework to reflect current and future public health needs and practice? And in order to get there, let me turn it over to my colleague at PHNCI, Reena Chudgar, who will walk you through our work plan.
Great. So on the next slide, As Katie mentioned, we are undertaking a series of activities to really answer the questions you just saw, as well as achieve the purpose of this initiative. As you'll see on this slide, we are currently engaging a task force, as Katie mentioned, again, comprised of leaders, subject matter experts, practitioners, and others who comprise the public health field, really to ensure that this is a field-driven effort. We also have recently completed an environmental scan, which I will talk a little bit more about in just a moment. But that's really exciting and available for everyone to view right now on both PHNCI and the Beaumont Foundation's website. So as you likely know, since you're attending this call, we are currently in the data collection phase. We have several different mechanisms for data collection through live crowdsourcing at different events, local, state, national in nature. We are collecting feedback from a variety of think tanks through our partner organizations, an online questionnaire, which we encourage you all to pass along to your colleagues and fill out, as well as the virtual town halls, which is why we're all here today. So we really want this, again, to emphasize to be a refresh that is done with the field, not for the field, and that's why we're really working hard to get the field's participation into this organizing framework. Next slide, please. So as I mentioned, we conducted an environmental scan, which again is available for anyone to take a look at, and conducted this really to acknowledge the 25th anniversary of the Essential Public Health Services and really the significance to public health that it's brought by documenting its history and the breadth of its impact to date. The environmental scan consists of both a non-exhaustive scan of the literature as well as key informant interviews that allowed for stories and other resources to be shared that may not otherwise be found in the published literature. And it really does a great job of describing how and why the Essential Public Health Services were actually developed, as well as what the use in the field has been over the last 25 years. So we really wanted to highlight this history and some of the uses that were discovered, really to both celebrate the vast use and impact of the Essential Public Health Services over the last 25 years, and then also to acknowledge and understand that we're building from a vast array of history and use for this effort, and to understand the potential impact that this effort will have on the field as a result of that. Next slide. So as we've mentioned several times, and as you all know, the Essential Public Health Services were created 25 years ago in 1994. So I wanted to provide a little bit of history to lay a foundation before we turn it over to get y'all's input. They were developed by the Public Health Functions Steering Committee, which was comprised of national government agency leads, as well as representatives from a variety of different national organizations. In 1994, in response to the need for public health to better describe its activities to the public and policymakers during the Clinton administration's efforts for comprehensive healthcare reform. So it was drafted by a working group or task force of sorts, and then vetted by the Public Health Functions Steering Committee. And it really serves as, and has continued to serve as, the description of activities that local public health systems should undertake in all communities. It's organized, as you see on the graphic here, around the three core functions of public health: assessment, policy, and assurance. And this colorful circular graphic is probably familiar with most folks in the public health field, that really describes each of the 10 essential public health services around the middle. Health departments and their communities around the nation really organize around the essential public health services as a way to, where some agencies are organizing the way they work around the essential public health services. Schools and programs of public health teach the essential public health services, and the framework informs descriptions and definitions of public health practice. And as Katie mentioned, the framework is also used as the basis of the PHAB domains. Next slide. On this very colorful graphic, we wanted to talk a little bit about how we know that the framework has provided a roadmap of goals for carrying out really the mission of public health in communities around the nation over the last 25 years. But as Katie has mentioned, there have been many changes, both in terms of what public health does and how it does it over the last 25 years. And there have been many assessments, a variety of different frameworks and standards that have been created to help understand where the field is now. As you'll see a couple of examples on this slide, we've seen Public Health 3.0 been defined. We've seen a culture of public health, and we've seen the foundational public health services, as well as many, many more. So as the public health landscape has shifted over the last 25 years, many public health practitioners and leaders and experts from the field really agree that it's time to revisit whether and how the framework can better reflect current and future practice, and how it can be used to create communities where people can achieve their best possible health. So with that, we're here today to get your input on what that might look like and what a revision or a refresh of the 10 essential public health services should look like to better help the field do the work that they do. I'm going to turn it over to Jessica to collect input from y'all.
Thanks, Rena. All right, now is the fun part. So hopefully that was a helpful background and reminder for those of us maybe who haven't been in school for a while and haven't remembered the history of this framework. We're going to do two things. One, we'll be unmuting the lines. So again, please be sure to mute yourself when you're not speaking. And we're going to start with a public input using Slido. So I'll invite you all to go on a different browser, either on your phone or computer, to slido.com, that's SLIDO.com, and enter the code EPHS. And we'll give you all just a moment to do this, and I promise it's painless and easy to use and fun. And we're going to go fairly quickly through a series of questions to get you all thinking, to give us the input, and you'll actually be able to see the results in real time. So if we can go to the first question. We would like to know, what do you see as the emerging public health challenges that are coming toward us in the future? Take a moment to think about that, and please type your answer into the Slido. Don't be shy, these will be anonymous. All right, seeing a few different things. We'll take another moment. So competition for healthcare resources, climate change, social isolation. I saw something about violence, drugs, cross-sector collaboration, data sharing, social determinants of health, changing demographics, the needs of the workforce with regard to data, racism, data insecurity specifically, immunization hesitancy, all really great things. All of these in the news lately too, right? Retiring workforce. Funding, a lot to do with the social determinants of health from different perspectives, trauma-informed care. These are fantastic. Thank you so much. Let's move on to the next question. So in thinking about what some of these and other emerging challenges are, what public health functions are essential to meet these challenges? policy and advocacy, great. Surveillance and epidemiology, cultural competence, communications, staffing, insurance. Collaboration, seeing some themes emerge, access to data, knowledge to influence policy formation, our future workforce, data infrastructure, fiscal analysis. Evaluation. Assessing systems through diagnosis and investigation, long-term strategies. Knowledge management and succession planning, great. Systems thinking, using the evidence base. All right, thank you. So in thinking about these two things and the overview we provided, what one word do you see in your mind when you think of the 10 essential public health services? What comes to mind for you? And this one should populate into a nice word cloud, so we'll see where there are some synergies in your thinking or not. And I'll encourage everybody to participate. Again, this is anonymous, but we really want to hear your feedback. So please chime in through slido.com. No overlap yet in our answers. I think that's the first time we've seen that. So normally, of course, in a word cloud, when multiple people say the same thing, the words get bigger, but you all have different thoughts. So it's great to see what you're all thinking. There we go, collaboration. All right, looks like some diverging thoughts. So I'm really looking forward to the conversation that we'll have in just a little bit. Thank you so much. Let's move on to the next question, which is, in what ways have the 10 essential services been useful? So in thinking about practice, how have they been useful from your perspective? And you can answer more than once. So organizing the work, providing a framework, shaping policy and funding priorities, some folks doing organizational assessment, strategic planning, a great reminder of the breadth of our work, workforce education, helpful in defining or describing the system, communicating, an understanding of what we do. I can't see a show of hands, but I imagine we often hear people have a hard time explaining, to their grandmother what it is they do for a living when they work in public health. You hear that one a lot. All right, let's move along to the next question, which is, if it were up to you to dictate the framework for the next 25 years, would you scratch it and create a new model from scratch, scrap it and don't create anything new at all, keep it exactly as it is, make some minor tweaks to the current framework, or keep the framework but make major revisions to it? I'd like to see if we could get a few more people to answer this one. So far, no one's saying to keep it as it is. No one's saying to scrap it and not have a framework. And no one's saying to start again. So a kind of even split between making some minor tweaks to the current framework or making some major revisions. All right, a few folks saying to scrap it and start again. So I'd like to pause here and actually have some dialogue. So for those of you who'd like to chime in, regardless of what your answer was, can you tell us a little bit more about what you're thinking? So for those of you who say to scrap it and create a new model, you know, why and what might that look like? For those who say to make major revisions, what might those revisions be? For the minor tweaks, same question, you know, what might those revisions be from your perspective? So remember, you need to have entered your PIN in order to speak, and make sure that you unmute yourself from your own phone. And please, let's have a little bit of discussion here. Don't be shy. This will only work if we can hear from you. So we mean it when we say we want, you know, to hear directly from the field. So we can't revise a framework without hearing your great thoughts in more detail.
This is Grace Castillo. Sorry, I'm getting a little here, but I guess we've all talked about how this really makes an impact on guiding what public health does and what public health should be. And so I think, given that they have that impact, they need to be bold.
Could you repeat that last? They need to be what?
A little bit bolder.
Bolder. Great. Thank you. And thanks for being the first one to chime in. Other thoughts? You can also share your thought without stating your name if that's more comfortable. All right, well, we've got a quiet group today. We would also ask that you can chat your thoughts into the questions box if you're not wanting to share them verbally, but we're very interested to understand the thinking behind some of these answers. So please be typing them into the question box. I see a few thoughts coming through now, and we'll go ahead and move on to the next question. Which essential service or services would you recommend changing? And that's a select all that apply. So take a few moments to answer that question. All right, we've only had a few of you answer so far. Hopefully everyone had their coffee either before lunch or after. Let's give this another couple of minutes. Again, which would you recommend changing? So nearly all of you felt that some minor or major revisions were needed. So where? To which essential service in particular were you thinking? A lot of thoughts around essential service number 7. linking people to needed personal health services and assuring the provision of health care when otherwise unavailable. A lot around mobilizing community partnerships, developing policies and plans, monitoring health status, inform and educating. We'll keep scrolling down to see if there are any that weren't noted. Looks like they're probably, my quick scan, I think it looks like they're kind of all accounted for, with a few being noted more highly, certainly essential service number 7 the most. So of course, you know what the next question is, and we'll move on to that, which is what concept or concepts would you change or add? So in thinking about what concepts would you change, for those that you just suggested changing, you know, could you please be specific and note the essential service number if you can, and let us know, you know, specifically what is it that you would change, or what's missing? What would you add to the framework that isn't there now? And I see in the chat box someone saying decreasing the number and complexity of definitions. So kind of a more general comment, not specific to a number, and that's fine. Emphasizing informatics, reducing some duplication, adding the equity lens, competent and diverse public health workforce that reflects the communities served, health systems change, define each one just more or perhaps better. More about systems thinking, assessment and change, social determinants of health and equity. So some themes that we've heard throughout the call today. Data, climate change, and again with the long-term strategies. Being nimble. Leave this one open for another moment. I'd like to see some more responses from you all. Public health role versus health system role. So a little bit of definition and guidance on that. What about when environmental health is outside of the public health department? Defining what we are not and why. Differentiating between governmental and, quote, private public health. Issues that affect health. So a lot here on partnership and how we approach partners, how we approach the community. The chief health strategist and cross-jurisdictional sharing. Working so that public health partners outside of government see themselves in this. An emphasis on collaboration. So really great thoughts. Bolder policy role needed. We'll keep going for a little while longer. Again, any concepts that you would change or add when we think about the existing 10 essential services framework. Removing jargon. Allowing this to be a conversation starter with the community. Connect. Aligning with 3.0. Seeing how the essential services can be expanded through leadership and innovation, again, across sectors. They're great. All right, we're going to leave this one up, and I'll encourage you all to keep submitting your answers here. We'll try to open the phone lines one more time to ask if there are any questions that you have for us or any other thoughts that you would just like to share that maybe weren't able to be captured through the questions that we asked here. We've got plenty of time left, so we want to take the opportunity to just have a discussion. Anything you all want to talk about with regard to this initiative, let us know. And feel free to keep typing your answers in as well. Thoughts or questions? All right. Well, this is a particularly quiet group. Oh, was someone going to share? Please.
Yeah, I was just going to maybe comment on somebody else's statement about let me see if I can mute myself here. On the idea of public health system and stressing that piece a little bit more, not just on the health system, excuse me, not just on the public health side. I thought that was a good comment that I'd like to echo.
Thanks.
I think that comment was a little bit tough to understand, just the connection is not great. So if you want to go ahead and enter what you said into the chat box, that would be really helpful.
Any other thoughts to share or questions for us? Yeah, we didn't really open up for questions after giving sort of the background and motivation for this project. So anything about that is certainly fair game for questions as well. All right, well, in thinking about next steps, we'll be collecting data through events like these. We have a lot of in-person opportunities at a variety of different groups, as Rena mentioned before. We will be at APHA, both the Industry Expert Theater that Sunday afternoon, as well as a session that Tuesday morning for those of you who will be in Philadelphia. We're convening our task force to synthesize all of the feedback we're receiving through these events and the online questionnaire to inform a potential revision based on what we hear in January. We will then put out that updated framework for vetting to the field, so another opportunity to provide feedback on whatever that proposed revision may look like. Convening the task force again in late spring to kind of finalize it. We'll also be working with communications experts. So a few of you mentioned kind of jargon and being able to better communicate about the framework, and we hope that through the public vetting and the communications expertise that the words will be clear and will resonate with folks. And then we'll actually go ahead and launch the refreshed framework during an event in June 2020, which is the invitation-only Public Health Innovation Summit and Showcase, the second annual one that PHNCI will be putting on. And then, of course, spending the remainder of 2020 really focused on dissemination of whatever the new or refreshed framework may look like. So that's a little bit more about our work plan. We do hope that you all continue to engage with us. If you have additional thoughts, feel free to go ahead and put those in the online questionnaire. It'll be very similar to the poll that you just went through. Also, feel free to reach out to us with any questions, over email. If anything else comes to mind, feel free to participate in the next town hall, and please do let your colleagues know that this was pretty painless and pretty quick, but we think very important. So please encourage them to participate to the extent that you can, and please continue to follow our progress and look for more to come in early 2020. With that, we will go ahead and give you back 20 minutes in your day. Thank you so much for joining us and for providing us with your feedback, and have a great rest of your day.